Hello lovely people, welcome back to another edition of Healthpoint show. If you are a returning subscriber, thank you so much for making time to visit my channel once again. If you haven't subscribed yet, please subscribe, like, comment and share. I appreciate you all. God richly bless you too. Did you know that aphrodisiacs can make you go blind? Yes, aphrodisiacs can cause blindness. If you want to know how, stick and stay to the end of this video and I'll tell you how. In this video, we are going to look at the side effects of aphrodisiacs. Now, aphrodisiacs are substances, either food or drug, that arouses sexual desires. Before that, let's look at what is called sexual dysfunction. So sexual dysfunction is the inability to achieve a normal sexual intercourse. This includes premature ejaculation, arousal difficulties resulting from either you have a low libido or you have what is called orgasmic disorder. When I say orgasmic disorder, I mean you have difficulty getting to orgasm whenever you have sex. Sexual dysfunction is a serious medical and social symptom that occurs in 10 to 52% of men. In women, it occurs in about 25 to 63% of women. Now let's look at some causes of sexual dysfunctions. Number one, we have medication. Some medications that are used in the treatment of chronic illnesses such as hypertension and diabetes can cause sexual dysfunction. Also, if you have a chronic illness, it can also lead to sexual dysfunction. Number three, if you have poor blood flow to the penis, to achieve a good ejaculation, you need a good blood flow to the penis. So if you have a problem with your circulatory system, it can cause sexual dysfunction. Number four, if you are an alcoholic person, if you drink too much alcohol, it can affect your system and can also lead to sexual dysfunction. The fifth point, getting too tired. In order to have a good and normal sexual intercourse, you need a sound mind and a sound body. So if you are too tired, it can lead to sexual dysfunction. The side effects of aphrodisiacs include number one, allergic reactions. This is a condition in which the immune system reacts abnormally to a foreign substance. So this could either be the drug or the food that you are using to arouse sexual desires. People experience reactions such as swelling under their skin. Typically, we have 2% of people having swelling in their eyelids. They could have a swelling in their lips, their hands, your feet, swelling in your tongue, your mouth, or even your throat. Some people actually have difficulty in breathing. So if you're somebody who has a history of allergy, it is very important that you check some of these medications before using them. Number two, we have hypotension or low blood pressure. Now, a sudden drop in your blood pressure is very dangerous if you have certain heart conditions such as hypertension and angina, or even an enlarged prostate. Now, how do you know that you have hypertension? You could feel dizzy, you could feel lightheadedness, or sometimes it can make you faint. If you experience some of these symptoms, you know that you have hypertension. So it is very important that you take notes. The third side effect that one can experience from taking aphrodisiacs include headache. You experience headache because the drug widens certain blood vessels in your body. It is reported that about 16 to 28% of people experience headache whenever they take aphrodisiacs. The fourth side effect that one can experience after taking an aphrodisiac is heart attack, irregular heartbeat, and stroke. This usually occurs in people who already have a heart problem. but sometimes it also occurs in people who do not have heart problem. It is very important to note that anytime you take a sexual dysfunction medication or an aphrodisiac and you experience chest pain in the course of sexual activity, stop having sexual activity immediately. It is very important. Wherever you've gotten to, if you experience chest pain, stop. Please stop right away. Point number 5, priapism. This is a long-lasting and sometimes very painful erection. It is a medical condition that needs to be treated right away. If not, it can damage the tissues of the penis and cause irreversible erectile dysfunction in less than 24 hours. This means that it can make you impotent. So whenever you experience priapism in the course of a sexual activity after taking an aphrodisiac, stop right away and report to the nearest hospital. The sixth side effect of aphrodisiacs is loss of vision or blindness. This occurs through a condition known as NAION. NAION is non-arteritic anterior ischemic optic neuropathy. This is an eye condition which causes damage to your optic nerve. Now, when you take the structure of the eye, we have the retina and we have the optic nerve. The optic nerve is located at the back of the eye. What the retina does is it converts light that falls on your eye into electrical impulses or electrical signals and sends it to the optic nerve. The optic nerve then sends it to the brain, and the brain uses it to create the images that we see. Therefore, when your optic nerve is damaged, it means that there wouldn't be any organ to send electrical impulses to the brain for the brain to use it to create images for you to see. So you experience a sudden loss of vision in either one eye or both eyes. It is worth noting that this NAION, which is a damage to the optic nerve, can also result from genetic factors. So if you don't know your genetic condition, it is very important to take care whenever you are using aphrodisiacs, especially the abuse of aphrodisiacs, in order to prevent blindness. I'm sure you learned a thing or two from this video. Please don't forget to like, comment, subscribe and share. Also click on the bell so that you can receive a notification anytime a new video is uploaded. Thank you so much. I love you all.